Some of you have been told that your blood pressure is fine, and your doctor isn't wrong, they were following the guidelines. But the problem is that the guidelines haven't caught up. Over 10 years ago, there was a study that was stopped early. Why? Because they realized that the threshold for damage that's happening to the heart, brain, and kidneys and other organs was a lot lower than we originally thought. Since then, the US and Europe guidelines have caught up, and even the blood pressure specialist guidelines in the UK have. However, the NICE guidelines, the one that your GP is following, still haven't. So I'm going to explain to you where your blood pressure should be, how to measure it correctly, because often that is part of the problem and the thing that most people are doing wrong, and what to do if it isn't where it should be. And I'll also explain why going over with your blood pressure, it's not like a speeding fine, it's actually much worse. I'm Dr. Ashley Hilton, I run a longevity clinic, and hypertension, otherwise known as high blood pressure, is one of the top tier things that I look at with my patients. Why? Because cardiovascular disease is still the #1 killer, and really there are 3 levers that we can pull on to reduce our risk of it. And I explain, it's a little bit like insurance. It's something that you need to sort out, and really every minute that you're not taking care of it, you're running a risk. But it is also something that you can check, sort, and then just monitor regularly. But a lot of people are ignoring it altogether, or they're just chasing the wrong number. But this catches out even the most health conscious people. There are people out there biohacking their way to infinity and ignoring this, which is arguably way more important than most of the stuff that they're doing religiously. But here's the scary part. You can't really feel high blood pressure. There are no symptoms unless it's really high, no warning signs, nothing. That's why they call it the silent killer. It's not dramatic, it's quite literal. Because around 1/3 of people in the UK have high blood pressure. Now, millions of those will not even know that they have it. And in young men, 2/3 of those with high blood pressure are completely undiagnosed. So the question really isn't, is my blood pressure high? It's, do I actually know what it is? And even if you've had it measured in the GP, the chances are that that measurement probably isn't correct. And in a moment, I'm going to show you exactly why, but more importantly, how you can do it properly at home yourself. Okay, so let's have a look at what's actually happening that's causing the damage. And here's how I explain it to my patients. Imagine you are driving fast in a car. Now, I say to the patients that there are 2 types of problems. There are threshold problems and there are exposure problems. The threshold problems, imagine that you're driving so fast that you're beyond not just the speed limit, but the little leeway that they allow as well, that beyond that threshold, you're going to get a speeding fine. So it's a bit like potassium. Anything over that, you'll see the consequences. However, blood pressure is what I call an exposure problem. It's the wear on the tires that is happening from going too fast. You're not going so fast that you'll get a speeding fine or you'll notice anything, but every moment that you are spending going that little bit too fast is causing that damage on the arteries. It's causing them to harden, stiffen, and that's what's causing the increase in blood pressure, which is doing all of the damage. Now, this shows in the data of the story of the trial that I'm going to tell you in a moment, but just so that you understand, typical blood pressure has 2 numbers. Typically, the textbook is 120/80. Now, the top number is the pressure when your heart is contracting, the bottom pressure when it relaxes. Now, in people aged 40 to 70, a 20 millimeters of mercury, so that top number 120, a 20 increase in that causes a doubling in the risk of death from heart attack and stroke. Not just the chance of it happening, but from dying from it. Sadly, it's not just a problem of the heart. It also affects the small blood vessels in the brain and in the kidney, so it becomes a whole body problem. Imagine it a little bit like a really powerful hose that's got a lot of pressure inside that from the inside out is tearing away the lining of that hose pipe. So don't worry, it's not all doom and gloom. In a moment, I'm going to show you what we can do about it. But it's just to highlight the importance of this damage that accumulates and compounds over time. A little bit like high cholesterol or smoking. Every moment that we are spent above the threshold of high blood pressure, damage is occurring, and it's something that can't be undone. So that brings us to the question of, where is the line? In 2015, the largest and most important blood pressure study ever was conducted, called the SPRINT trial. They took nearly 10,000 people with high blood pressure and a cardiovascular risk and split them into 2 groups. One was treated to their blood pressure below 140, which is the standard target, and the other group was treated more aggressively to get below 120. The trial was meant to run for 5 years and they stopped it after 3. Why? because the group on the intensive management were doing so much better that it became unethical to keep the trial running, knowing how different the outcomes were. The results were a 25% reduction in things like heart attack and stroke, a 43% reduction in death from cardiovascular problems, and this is the one that shocked people, a 27% reduction in death from all cause mortality, so all deaths from any sort of cause at all. So those relative risks are one group compared to the other. The absolute risk is the amount that gets reduced overall. So for example, let's say that 3% of deaths occurred every year in the control group, and then in the study group only 2% happened. That might only be a reduction of 1%, but that is 1% every single year. And like I say, these things accumulate. So over time, those compound. So the smaller group only getting 2% versus the one getting 3% over those years will be going further and further apart. And it's such a big difference over the course of, say, 20 years. That's why it was deemed unethical to carry on. And they amended the guidelines to mean that people should aim for that below 120 because of the outcomes that they observed. After Sprint, the US changed their guidelines, Europe changed their guidelines, Japan changed theirs, and just recently, the British and Irish Hypertension Society, i.e. the UK's specialist blood pressure body, published a position statement saying that the target should be under 130/80. But NICE, the body that set the UK clinical guidelines, still say that below 140/90 is fine. So if your GP says that your blood pressure of 135/85 is nothing to worry about, they're following the guidelines, but the evidence suggests that those guidelines are behind. So let's look at the way out of this and the 3 things that you can do, because the good news is that blood pressure, unlike say cholesterol, responds actually really well to lifestyle interventions. So for many people, they can sort this without needing medication. So step 1, we need to measure it properly and get an accurate reading. If you look on the screen here are all of the things that can throw off your blood pressure and increase it, and just by how much. And you might recognize some of these from the last time you had your blood pressure taken, maybe in the GP practice. So it's really important that we measure it properly, and bear in mind all of these things, because when we sit down to take it, we want to be sat down, arm at heart level. We want a cuff that fits properly. We want to make sure our legs are uncrossed, we're not speaking, that we've rested at least 3 minutes before, ideally 5. And then to do it properly, what we do is take 3 measurements with that 5-minute rest of gap in between. So we want to take the average of those 3 measurements. We want to do that 3 set of measurements 2 times a day, usually morning and evening, and we want to do that whole process for 2 weeks and take the average for all of those readings. That is how we know truly what our blood pressure is, and we can be sure that it's accurate. Step 2 is moving our bodies is probably one of the best ways to bring it down. So things like zone 2 cardio, the pace where you can just about hold a conversation for around 90 to 80 minutes a week, can drop systolic blood pressure, so that top number, by around 8 millimeters of mercury, and diastolic blood pressure by about 5. Strength training also gives you about a 2 to 3 point reduction in the long term. And interestingly, isometric holds, so things like wall sits, can drop systolic blood pressure by about 6 points. And if you're carrying extra weight, every kilo that you lose can drop the number on both the top and the bottom by 1 for each kilo. Step 3 is to fix the basics that you're probably neglecting. Poor sleep raises blood pressure. Chronic stress raises blood pressure. These aren't soft lifestyle suggestions, they're physiological drivers. Your blood pressure should dip around 10 to 20% overnight when your parasympathetic nervous system, so that's like the opposite of your fight and flight that kicks in when you're sleeping. But if you're chronically stressed, that dip doesn't happen, so that high threshold blood pressure beyond what we said is happening around the clock. So if lifestyle gets you in check, then brilliant. That's what we want. We want to just sort it and then carry on living our lives and just come back and check it occasionally. However, if these aren't able to do it, medications can help. And it's much better to be on a medication to keep it in check rather than be having this unchecked damage going on in the background without us realizing and accumulating over time, like I said. But it's important to know that this is a balancing act. We want to stay within a certain range. Low blood pressure is dangerous, so we don't just want to bring it down as low as possible. Think of it as a Goldilocks problem. Not too much, not too little. We want to get it just right. So here's what I want to leave you with. Blood pressure is one of those rare things in medicine where the problem and the consequences are huge, the solution is incredibly accessible, and people are simply just not doing it. You can't feel it, your GP might not catch it, and the guidelines are probably a decade behind where we should be. However, with a simple £50 home solution, this is something that we can, like I say, just understand, sort it out, set it on autopilot and monitor it, and then just forget about it and go and live your life. But we want to get it in check to avoid that problem of the damage that's happening without us knowing. But this is probably one of the highest leverage moves that you can do for your health this year, so definitely worth paying attention to. If you would like some more stuff about how you can understand your health, kind of put it on autopilot, so to speak, and monitor it, there are some videos that you can watch here, and subscribe to the channel because we've been getting regular videos. But otherwise, if you've got any questions or any requests for me to do other videos, maybe go into the sprint trial more deeply, or you want to ask or comment about any of the stuff below, just drop me a message below and I'll respond straight away. Thanks for watching, and I'll see you in the next video.